Research in Oklahoma to study the aging process has gotten a $3.8 million boost. A 5-year grant from the National Institutes of Health will establish the state's first Nathan Schock Center of Excellence, one of only 6 in the entire nation. The money will help researchers better understand the impact of aging and ultimately improve the lives of older citizens across Oklahoma and the nation.
Dr. Arlen Richardson has spent much of his career researching what happens when we age. With baby boomers now entering their retirement years, knowledge about the impact of aging takes on new urgency. Richardson says as people age, they become increasingly at risk for a host of ailments.
An example is Alzheimer's disease. If you're 40 or 50 years of age, your chances of being diagnosed with Alzheimer's disease in the next 5 or 10 years is probably about the same as winning the Oklahoma lottery. On the other hand, if you're 85 years of age, your chances of being diagnosed with Alzheimer's or dementia is 50-50.
Richardson will serve as director of the Schock Center for Excellence, which will promote collaboration between the University of Oklahoma Health Sciences Center, the Oklahoma Medical Research Foundation, and the Veterans Administration Medical Center in Oklahoma City. Richardson credits that collaboration with helping them obtain the grant.
I see that as one of our winning cards, is that we were able to bring together 3 diverse institutions that had a focus. Probably individually, it would have been very difficult for each one of our institutions to compete because we were competing with all of the health science centers, universities across the nation.
OMRF President Dr. Stephen Prescott says collaboration is crucial to aging research.
One of the great misconceptions about how biological sciences happens is that it's a brilliant scientist goes into a dark room by herself and has a great thought and then writes a paper. It's a big discovery. And nothing could be further from the truth. It's a very social interaction. These happen in laboratories where people interact all the time. Ideas are shared, expanded, critiqued, revised, and so forth in those groups.
Holly Van Rimmen with the Oklahoma Medical Research Foundation's Aging and Metabolism Research Program will serve as co-director of the Schock Center. Van Rimmen says the research performed here will put Oklahoma on the map in the developing field of geroscience, the study of how aging impacts disease.
It is a very exciting and new and hot area of aging research, and so we'll be able to have people identify with Oklahoma as being a center where geroscience is important.
The NIH grant will also provide pilot funds for investigators to pursue other areas of research related to aging.
They can apply for funds through the Schock Center, and with these funds, then hopefully they will be able to generate additional research ideas and data that can then help them to get funded by NIH or other funding resources.
That, in turn, could help to attract and retain Oklahoma-based researchers.
I think the visibility alone, and of course the publications that will come out of this will definitely help us to attract new people, and maybe the next time we put this grant in, we have another core that has something even better than what we have now.
The Schock Center won't involve new laboratories or other structures. Instead, the money will be used to fund research across many facilities on the Oklahoma Health Center campus.
The goal is that if we can understand what is causing the phenomenon we call aging, is that we'll be able to develop strategies that will prevent or slow down aging.
To the general public, slowing the aging process means lengthening lifespans, enabling people to live well into their 80s, 90s, and beyond.
The other way of thinking about it is that as aging, we start losing function with time. Right? And what we'd like to do, at least in the first wave, is keep that function. Whenever we're at our peak function at age 28 or 42 or whatever, keep that all the way out until age 95.
One area of study Oklahoma researchers expect to pursue will be epigenetics, which involves changes in the DNA of cells. That research could have an impact on other diseases as well.
This could be important in things not only in aging, but things like PTSD, where a person is exposed to a stress and that stress somehow alters them for life. And we think that an epigenetic mechanism is how this happens.
Ultimately, the goal of the research made possible by the grant will be to extend and enhance human health in the very near future.
I'm very optimistic that in the next 5 to 10 years, we're going to have clinical trials. In fact, many of them are started right now, where we're going to be looking at how the things that we see that have an impact on aging in animal models can be translated to humans.
That research is likely to become even more significant in coming years. According to the U.S. Census Bureau, about 46 million Americans are now over the age of 65. That number is projected to increase to 74 million over the next 15 years.